We have been blessed this morning for all of those of us who are currently aging or have aging parents. Because we have in our parish Jeanne Merritt, who knows how the system works and what we need to do as we are looking out for ourselves and friends. And think of all the people who don't have families. They might be calling on you as well. If you got a neighbor that something happened and they have no family. So we have Jeannie and Jennifer. And they know the system for us old folks. Someone's really good. Somebody knows that. So I'm going to hand the mic off to them and get rid of all these vestments from the 8 o'clock service.
Good morning.
Good morning.
Morning. We're going to have this informal, if that's okay. So if you would like me to stand up, I will, but I think we'll sit, if that's okay. So again, I'm Jeanne Merritt, and I go to the 8 o'clock service with my family. And this is my business partner, Jennifer Rodgers. I've had the fortune to work in the senior industry in Central Oregon for about 20 years in various settings, whether it's been in a nursing home, hospice, social work, Central Oregon Council on Aging, doing Meals on Wheels, in the hospital. And what we have both come to realize is that there's many gaps, and particularly in Central Oregon, gaps for seniors. So Jennifer and I, about a year ago, decided to create a geriatric care management firm. There have been a couple of them in town in the past, and currently none other than ourselves. We call ourselves Ben Senior Care Management. And so we officially went into business in February of this year. So we're into about our 8th month. I know that Jeannie McBurnett is familiar with geriatric care management firms. Has anybody else heard of geriatric care management? Yeah, great. Okay. So again, we're here to fill the gaps. Currently, right now, Medicare does not recognize geriatric care management firms, so our fee is a private cost to whether it's the senior or to the family member. Would you like to say anything? So the talk, I just wanted to mention what a geriatric care management firm is, when you might want to use one, and then also I wanted to hit some points that I think are really, really important as we all age, that we have in place that make things a little bit smoother when a crisis occurs, and then open it up for questions and answers. So a geriatric care management firm is a pretty simple concept. The family hires a professional advisor to act as a guide through the maze of long-term care services and providers. The care manager has been there many times, but perhaps the family hasn't. So it's a new experience for families and for seniors, but we've seen as professionals this situation over and over again. And while it's not a cookie cutter solution, we do know some simpler ways to get things done.
Yeah, and I would just add that sometimes the family members live here in town, but they're just working and they're overwhelmed. Or many times the kids maybe don't live in town, and so they don't know who to contact. Also, when you work with a geriatric care manager, specifically Jeannie and I here in town, we've developed relationships with healthcare workers in the community for a long time. So we really know who we would refer to and who we would not refer to, which I think is really important, because when you're doing this, you want to do it right the first time around. And I think that's the other thing that can be real helpful when you hire a geriatric care manager.
So Jeannie, even
Yes.
though people are living in
like Stone Lodge or Whistling Winds, they still could use your care.
Yeah, so our job is to go wherever the senior is living and really assess the situation. What we've found is that oftentimes, even when you're paying for a service, you're not really getting the full benefit of that service. And we can come in and say to an assisted living, perhaps you can do this, X, Y, and Z, in a gentle way. Again, we've developed relationships and people trust us. But we can also, the ancillary services that are available in Central Oregon, like home health, for example, which is a Medicare covered benefit. You have to have a skilled need. They can come out to the home, and we might say to the home health agency, hey, can you come in during the times when there's not scheduled care? So there's not the overlapping, and so the senior in need has an extended amount of support rather than two professionals there at one time.
So will they do that pretty readily?
They do.
Good.
But it takes an extra set of eyes and ears to ask for it. And yeah, and from their perspective also, the professionals, they're super busy. You should always have an advocate in every stage of the system. So at the hospital, you should have a social worker or a nurse case manager there for you. In the nursing home, you should have a social worker or a nurse case manager. In the assisted living. But oftentimes they're so busy, they can only hit the really big cases. And so the other people could slip through the cracks. So just, excuse me, a couple of times that you might consider hiring a geriatric care management firm is when the senior can't remember doctor's appointments or can't remember what the doctor said. Medications are getting mixed up. They're not ordering the medications on time. Bills aren't being paid. Telephone services might be cut off. Frequent calls about the same sort of subject. That sort of thing can offer, a geriatric care manager can support.
Jeanne, can I add one to
Yes.
that? But I have a long-term experience with geriatric care management in Florida, because this service is available nationwide, so if your parents are someplace else. And what I found was my mom and dad were both living, my mom's got Alzheimer's, and as it advanced, by having a geriatric care manager, she became sort of my father's sort of trusted ally in helping my mom, and that changed much for the better his situation. So that's another time I would say. You'd have two people together, but one of them's really overwhelmed with trying to do the care, and this helps. In fact, I would say this gal actually sort of saved my mom's life at one point by saying to him, I think you need to get a second opinion on that one from so,
And
anyway.
it saved you too, didn't it?
Oh yeah.
Yeah.
So excuse me, but thank
No,
you.
please. That's
No, and that's a great point, and we have several cases like that right now where the primary caregiver, say specifically the husband has the Alzheimer's and she's the primary caregiver, and they've worked their whole life and now they're going to be retired and he's diagnosed with Alzheimer's, and she is completely burnt out and having a hard time doing everything, and so didn't even know which way to kind of turn. So she hired us to do everything from setting up a care plan and really bringing in some care providers to give her respite care so she can charge her battery and continue to be his primary care provider. She had a long-term care policy claim, and you know how much fun it is to work with insurance companies. They really want to, pay that claim. And so we have taken that on for her to make sure that all the forms are completed, all the doctor's notes are there, and that she will get that benefit that she's entitled to or he's entitled to, and that it's okay for her to leave for a day and recharge her battery. And eventually it will be more days that she needs to charge. And then we'll follow her along the case, and when it is time to move and she can no longer keep him in the home, we'll point her in the right direction of the appropriate place. And that's a lot of times, anybody can Google, assisted livings or memory cares, but there's a lot more that you want to know before you just pick one, and that's where we come into. So that's a good point, Jeanne.
So a couple of pieces that I think are important for all of us to talk about and to know is, we brought some forms. The post form, is everybody familiar with this? Yeah, this is the biggie. So it is a physician order. It's the only thing that would prevent the EMTs from resuscitating you if 911 were to be called. So we've had a couple of instances when people didn't want to be resuscitated and they did not have this. And then they're hooked up to life support and the family then are left with obviously a very difficult situation and decision. So this is something that we've got, we've brought extra ones if you don't have it. There's 4 questions, or excuse me, 3 now. They changed it, but in the event of an emergency, do you want to be resuscitated? If you're found with no heartbeat and we're not breathing, do you want CPR or not? The second one has to do with medical interventions, comfort measures only. That's more for hospice, or really some people who are fully functioning, don't have a life-limiting illness, still don't want a lot of interventions. The other piece under medical intervention that you can choose is limited treatment. That means that you could be seen in the hospital with some treatment such as IV antibiotics, IV hydration, cardiac monitoring, and then the highest level of care is full treatment, and that means you could potentially be in the ICU intubated. So those are the 3 different options under medical intervention. And then the third question has to do with artificial nutrition. If you're unable to swallow and eat on your own, do you want artificial nutrition is one. Do you want it just for a limited amount of time, or do you not want it at all? A lot of the clients that we see are very elderly, and it's hard once you do the IV nutrition to decide when you want to pull that out. So we generally advise that it's either no artificial nutrition or yes to artificial nutrition. It's not that middle ground, again, because then later on the family have got to decide when they pull that feeding tube, which is a difficult thing. So this then is, you go over this with your physician, and he signs it or she signs it, and then it can go on the state registry, and it goes on or around your refrigerator or in the freezer. And every EMT in Oregon, if it doesn't stick, that's it. In the freezer. And every EMT is trained to immediately, if they're called, good morning, if they're called, they go to the fridge first. So that's important. We've got copies of that. The other pieces of information I think that are also important is the healthcare power of attorney and living will. So there's healthcare power of attorney and financial power of attorney. Healthcare power of attorney is a form in which if you're unable to speak for yourself, you assign somebody to speak for you to make healthcare decisions. In Oregon, we also have advanced directives, and those offer different scenarios. If you're close to death, or if you have a life-limiting illness, or if you're painful, how much intervention do you want at those different times of your life? So the advanced directive will oftentimes give instructions for your power of attorney on what you want to have done or what you don't want to have done. And that form in Oregon can be one full form. So this is the advanced directive, and you can get a copy of it online if you just Google Oregon Advanced Directive. And it gives, again, the different scenarios of what you want to have done and what you don't want to have done. And then it also assigns the healthcare power of attorney within the advanced directive document.
Do you have to have that renewed every once in a while, or once
You
it's
don't.
signed, that's it?
Unless you want to change it, and so it is revocable. You can, and there's a question on here, do you revoke your past ones? And the other nice thing is you only have to have 2 witnesses. You don't have to have attorneys look into that or anything. So that's another piece. The advance directive informs your healthcare power of attorney what to do if you can't speak for yourself, which ultimately are these answers. So it kind of flows together, albeit confusing enough. The other one is financial power of attorney, similar to healthcare power of attorney, but it's, hey Maggie, but it gives the right to make financial decisions if you're unable to make them for yourself. The standard is that you don't have a healthcare power of attorney be the same person as a financial power of attorney. It can be seen as a conflict of interest. So I'm going to pull the plug on mom, and I'm also going to disperse her monies as I want it. It's not a hard, fast rule, but it's just something to keep in mind. Also with the healthcare power of attorney, you want to be able to assign it to somebody that's okay following your instructions, that they don't want tube feeding, that they don't want to be resuscitated. What other things?
Does your firm do power of attorney, healthcare power of attorney?
Do we act as a healthcare power of attorney? We do have a couple of clients that we are doing that. It's more, we're testing the waters because it's almost like a lifelong commitment. So we do have 2 clients right now that we are doing that for. Yeah.
Because I would imagine sometimes you have situations where you have to make a hard decision in the family members' minds.
Right. But hopefully, if we've done our job well, we all know in advance what that senior wants, and then we can advocate for those things to be done or not to be done on their behalf. Yeah.
Do you need both the advance directive and the pink sheet?
Yes. It's you don't have to, but if this will keep you alive or not keep you alive. So this is an emergency sort of situation. The advance directive is if you're in the hospital unconscious, who can speak for you? I'd suggest doing both. And again, it really is, we could have done a 30-minute, everybody fill out their advance directive, fill out the post form, and could have done a workshop that way, but do you have a question?
Well, the healthcare representative is also capable. It's not, I think the important piece is not just necessarily an end-of-life decision. The pulse is an end-of-life for individual's control at the point of a emergency response. The healthcare representative and the advance directive goes into more nuance about if you're unable for one reason or another to give the medical team your desires as to what kind of treatment you want,
Right.
for the representative to be able to speak for you. So
Exactly.
It's not necessarily as much an end-of-life decision-making matrix, although it can be, but it's broader than that. It also allows that person to circumvent the HIPAA restrictions, which they can talk to medical
Right.
personnel, get records.
Yeah. And that's
So it's broader.
Yeah.
If you refer it to the pulse, that's a very limited use. The healthcare representative is a much broader participation in decision making.
Yeah, good point. And also the HIPAA piece is important. It's a fair to get through the medical system. So it gives your healthcare representative the right to talk with physicians and the medical community about what's going on with the senior.
And advocate for you, where the pulse form is not going to do that. I mean,
Right.
so that advocate, there was a point when we were caring for Dwayne's mom where we had to say palliative care only. We just wanted to be sure that everyone that was part of her care at the end of her life, too, was power of attorney.
Yeah, good. Yep.
And you could do it if you have that power of attorney. You know, Dwayne could say.
Yeah, this is my, right, exactly. Yeah.
Kind of piggybacking off that, I think what we're trying to do as we get out there and talk to the community is just talk to people about having these conversations when they're well and healthy instead of in a crisis manner. A lot of our situations, though, are, you know, in a crisis manner, and they haven't planned appropriately, or they haven't asked that person kind of what their wishes are. It makes it a little bit more difficult. But we certainly go in there and we'll help them in a crisis situation as well. But things such as, you know, funeral arrangements, just knowing what that person's wishes are, cremation or burial. We also, you know, people need to talk about their insurance and what that covers, and if they have the right insurance, prescription drug coverage, just all those little things that you just need to be aware of that can really impact you if you're using the healthcare system.
Jennifer,
Yes.
can you help people with veterans benefits?
We have connections, and we're connected with the resources that do it, and we know some of the rules and regulations, and so we can help guide them there as well. It's a tricky one, but we know who to talk to, and half the time that's what it is, knowing the right person to talk to, so, yeah.
And our contact for the VA right now is not the Deschutes County person, it's the Crook County.
Oh, okay.
Because she's really phenomenal. I mean, so it's, you know, it's knowing those little pieces, so, yeah.
But you know where to go to get it.
Right.
Yeah, good. That's very important.
Yeah, it is.
And there is also a piece of our business that we do, which is called socialization and life enrichment. And for folks that maybe don't have family members here or can't be here all the time, and they just want us to go in and check on them and visit with them, I have a lady that I see twice a month that is in her late 90s, and she lives in assisted living, but she no longer likes to go downstairs anymore because she's had 8 of her friends pass away in 1 year and the loss of a son. So knowing that I'm going to come and visit with her every so often, and we talk about a lot of things. We talk about how she grew up in Italy during World War II, and I mean just all things that bring joy to her. And you know, she's got a great family and great daughters, but they can't be there all the time. And it's amazing. You know, we need to value these people that have given so much to our country, and that's a big piece of it. They really enjoy that socialization, and whether we take them to lunch or coffee, we do that too, and that really helps with people's overall well-being and dignity.
So I think that's kind of all we have right now, and just know that there are advocates out there. Central Oregon Council on Aging does the Meals on Wheels program, an Oregon Project Independence program, all to try to promote aging with dignity and staying in the home as safe as possible. They're just very, very limited in their resources. And again, there are social workers and nurse case managers almost throughout the whole stages. So we're just a piece of that, and we're having a great time filling it. Do you all? Yeah.
I just have a question. When we went to move my mother from in Portland to be closer here because her medical needs were increasing and such, we thought she was going to be able to be independent. We should have had an evaluation before we moved her, what kind of care she would need once she got here. And why that made a difference was once she got here, she was falling out of bed, and she needed to be more into assisted living. And rather than move her from the institution she was living in into their assisted, they were booked up. And so if we would have booked this to be already into assisted, she would have had care 24 hours, checking in on her, and where then during that period of time, almost 3 months, we had to pick up all this extra care to have a nurse there 24 hours.
And that's that's expensive. And our goal is always to try to get it right the first time to save you money and heartache. And I mean, not to say that we don't misevaluate, but we do go in and provide that assessment and say, it does look like she needs X, Y, and Z.
So that's important. And again, to try to get it right the first time and do a proper assessment. And then looking into the future. Is she diagnosed with any sort of cognitive disabilities? So knowing that she's going to age into becoming more memory impaired. And then
Jeannie, have you had experience like you're taking care of a family member here and that person moves somewhere? Would you follow through and make sure when that person moves that whomever is looking out after them up there or wherever, you refer and do all that?
yeah, we did. We had a couple of people that we have transitioned down to Southern California. So we did the research of those different institutions in Southern California and did the bridge, making sure they were well supported. Yeah, whether you're moving out of town or just here within Central Oregon.
And for continuity of care is finding the right physician team as you transfer. You know, we needed to find someone that would be her primary care physician down there that was accepting new Medicare patients, which is also a challenge here in Central Oregon if somebody moves here, but we'll help them through that. So just making sure that, you know, all the T's are crossed and the I's are dotted. So we've done that a few different times where they've had to end up moving the family out of here because the family didn't have anybody and they needed to be essentially really closer to their family members down there. Jeannie's a licensed counsel social worker, so there are times when we transfer people from their home into a new facility, and that can be quite traumatic, and so she does counseling with them. There's what they call transfer trauma. Very hard to be independent, living in your home, and then all of a sudden, you know, things are different. So she'll work with them as well on that, and she also does a lot of grief counseling as well, if that's needed.
Yeah.
So who's your client?
Who's
Does
our
that
client?
vary? The elder, the family? And then the secondary piece of that question is, I'm sure you've never had families that need mediation between the elder who might be slipping
Yeah.
and the kids.
Yeah.
And so,
So
some comments about those things.
yeah, really our client is the whole family unit. If it comes down to it's not a functional family, excuse me, it will be the senior in need who is our client. So hopefully we can get everybody to work together. If we can't, then we're going to advocate for the senior. And I actually really enjoy family mediation. That's what gives me a lot of oomph for my work. So, you know, counseling, while I enjoy it, I don't enjoy it half as much as I enjoy the mediation. So we do that, and it's a time for all of us to get together, lay all the cards out on the table in a dignified way. If we can't do it in a dignified way, then we've got the answer and we move on, we move forward. So, yeah.
Jeannie, just one tidbit from my own experience on the PULSE form.
Yeah.
It's probably not a bad idea to have a list of all medications available.
True.
True. If and when the EMT would arrive.
Yeah, I wonder, I've never thought about that, but just attaching your medication list to the PULSE form, the one piece that you would need to remember is that as your meds change, you need to change that.
Yeah, that was a little chaotic.
Yeah.
I experienced that.
Right.
One time.
Sure, that makes a lot of sense. Yeah. Any other questions or thoughts? Y'all got church soon.
We've gone through this with my mother, my 96-year-old mother, and we found that your piece was one that was really messy, and that's really helped out with finding people that do your piece.
Yeah, thank you. We do find, I mean, that we are helpful and that we have the solutions. I wanted to be a hospice social worker for the rest of my career and just realized that there were, even in hospice there was a missing piece. And we're happy and honored to fill it, even through the QuickBook learning curve and the website and all that.
Well, do you find the needs, can you service the needs of just the two of you?
So far we can.
Yeah. And then just in wrapping up, this is a really good book. I don't know if anybody's read this, called Being Mortal. Okay. Yeah, okay. So it kind of is a nice book that just talks about respecting people and honoring them, really what their wishes are as they age into the system. It's really actually an easy read. And then the other thing is, in the Pulse magazine that came out in the bulletin on Monday, there is an article in here that they did on geriatric care management, calling Navigating the Seas of Aging. And so we brought some of those copies for you, and again, it just gives a good overall
On the mainstream marijuana.
So again, it's new to Bend. It's not new to the United States. Like you said, in Florida, it's very popular in Southern California, but we have such a high aging population here in Deschutes County. That's what we saw the need for. So
we'll leave the pulse forms out here, and then the pulse, if anybody wants to read a little bit more about what we do. And yeah, I think that's probably it. Thank you all for
Thank you.
attending.